Okay, thanks, Ben. And if you could go on to the next slide, please. Yeah, and again, I'll begin by recognising that I'm on the land of the Ngunnawal people and pay respects to elders, past and present, and also to their youth, as we should for all youth, who are a major target group for us within the TIS program. And they're people who we need to listen to, we need to target because they're our future. I'm Kungaraka on my mother's side, Huge on my father's side from up in Darwin, just outside of Darwin, but as I mentioned, live in Canberra. Next slide, thanks, Ben. So I wanted to firstly just recognise that we are in testing times, and that you have to bear with us in all this new technology. I think it's been absolutely fantastic the way that we've been able to respond since the COVID lockdown, to be able to get online and run these sessions. They don't substitute for face-to-face, and we're really keen to get back to being able to visit and to conduct these in face-to-face. But as Ben no doubt talked to you before, in the whole lot of these programs, we've got to be a bit disciplined in presentations, and nominated people ask the questions. It's unfortunate that we're into that, but that's part of what we're at. I wanted to just take the opportunity to go through, and I know there's a few new people here at the presentation, and just to go through and remind people about the TIS program itself. And because we're just approaching in another half a dozen days the halfway mark of this current tranche of money. 2 years ago, we got the Minister agreed to $184 million, there or thereabouts, TIS program over 4 years. We're coming to the end of year 2, so it's a great time to reflect on what's been achieved and where do we go to in future. This second half is really where we should all now be well and truly understanding what the program is about, and start to achieve a lot more than what many of us have been able to do. And I talk in general terms across the nation. And I should say, for those that haven't met me, I hope to get around to visit you over time. But my role as National Coordinator is to support you guys, and also within the department. And so, I travel a lot and am the interface. Of course, your primary interface is with the NBPU, but I'm also available for the regional tobacco coordinators and senior people who need to get some info. So in the program, I guess the key things that are up there is that we've got 4 years of funding, halfway there. We still have to really target pregnant women and remote area smokers, which is important. And I'll show you this a bit later, not the women, but the remote, why that becomes a priority. But, both those groups are the ones that we're seeing not enough movement in the incidence or dropping down of smoking. And of course, the funding included Quit Line and Quit Skills, but also there's a very significant evaluation component to it, or 2 lots of evaluation, and that becomes really important. And I guess a bit later we'll hear from Raglan. And there are other few smaller bits in the program that we need to look at. Thanks, Ben. Yep, go again. I should be following my own. So they were the 2 bits that I want to talk about. The other key point is that within the TIS program, and this is a message that has gone out to all grant recipients, originally 37, we're now up to 40, but and the CEOs particularly, who are the hosts of the money, and that is to remind people that the TIS program now is different to what it was in the past, where it's back to where we started off with in a population health approach, and that is that we want to deal with groups rather than individuals, and that that our target groups are those people who don't use AMSs. It's other people in the population. And when I say don't use AMSs, it's not a resource for the AMS who host it, because there's only 40 teams out of 150 AMSs across the nation. So not every AMS gets it, but every AMS has a responsibility to deliver tobacco anti-smoking interventions through brief interventions and so forth. So ours is to reach those who don't use the AMSs, who don't get access to services on a regular basis. So that throws up a bit of a challenge, and it's important. And they also got a message from the Minister to report back to the department about what other initiatives they're doing within their AMS to address smoking and of their clients. Okay, thanks, Ben. All right. There was a CEO meeting on the 7th of May, and we had quite a number of CEOs, but other senior people, and we re-emphasised in that, exactly the same messages we're telling you, to make sure that they were responsible. The TIS program, you've seen this slide. If you haven't seen it, you need to have a look at it to understand that it's more than just you guys as the funding bits. There's myself, there's the NBPU, there's the evaluation components, there's also the quit skills and quit line programs that we provide funding support to, and it's also about how the department works with and I do in another way with the state and territory jurisdictions to make sure that they also do their responsibility. So I guess the bigger picture is that we are one component of quite a number of other initiatives that are happening to try and address smoking amongst our people. So it's important that we do a lot of coordination, and make sure that we don't duplicate. Try and identify where there are gaps and so forth, and we've got to be strategic. And that's the big emphasis in all of this is that we are a resource that is one that is very strategic. Now, there's also different ways in which TIS operates around. You guys in Queensland, many of you don't get direct funding from us. You get funding through the Institute, and who then disperses the funds and have some hybrid operations where you have operatives who do deadly choices as well as TIS. But in all of this, we need to make sure, particularly when it comes to evaluations, because that's what's going to determine whether we get, well, it won't be the only source, but it'll influence the level of funding we get into the future. So we've got to be able to demonstrate that smoking is an important part. In some of the other states, we have people who do alcohol, tobacco, and other drugs. So they're one person who does the three of them. But instead of, say, for example, we fund 2 positions, they can then get 6 or 8 people working because they share the resources, and that happens a little bit in Queensland, and that'll be happening more in the Torres Strait as well, in the way that you go about business. But we can't underemphasise the need for data, both data collection and reporting, and to know that NBPU is there to support you. Thanks, Ben. So I wanted to just, and I prepared this slide at the very beginning, 3 months ago when COVID-19 came out, because we are doing things a lot differently. We have been restricted in our movement. We're not able to do what our core business is and go and meet with groups because we've been stuck at home. So I wanted to just again mention that we recognise that, and that'll be able to be reflected in your reports, because you won't be able to do your travel. as you've done it in the past. You won't be able to do the servicing the way you've done it in the past. But that doesn't mean you don't do anything. And I guess this is what we wanted to explore a lot more at, during this workshop, as to how you go about your business and still have impact, even though we're doing it a bit differently. And I said 6 months, that's what we thought at the beginning. It could be still another 6 months from now, could be 12 months. We don't really know, and it just depends on how COVID-19 is impacting. Some places we have no reports, but you know that Victoria, we're still seeing it very active down there. In New South Wales, it becomes active. There's more cases there than other states, but it doesn't take much for for infections to be transferred. And that's the brilliant thing about what's happened so far, because we've been very decisive and led, community-led within the Aboriginal sector. We've only seen, I think, around about 60 people who have been reported to be infected, and we have not had a death, which is absolutely brilliant. And when you think about and you see what's happening internationally amongst Indigenous people, where they're really, really impacted. The Navajo in South America, also tribal peoples are being decimated. And so we are very fortunate. And so we have to be vigilant and make sure that we continually not do what we've done in the past, but look at alternative ways. Thanks, Ben. The other is to take the opportunity, if you are stuck at home and you can't do things, to look at self-development. And one of those bits of self-development is understanding, like the back of your hand, what's in the TISRIC and on the TIS website, and take the opportunity to do the planning. Thanks, Ben. The other is, the questions about how to report on your activity, that because you're not getting in the field, and Desley will cover off on this a bit later in her presentation, because it's going to be important, but we just wanted to reinforce that we're very much aware that it's going to be different. Thanks, mate. At the beginning, there was an issue that our mob didn't have enough access to equipment, and so we've sent notes out to all the officers to say that nobody should be without equipment. There's enough money in the TIS program, and it's actually very generously funded, and all the IT equipment should have been there. People should have had access to it already. So if they haven't, make sure that they do have it. And if any of the grant holders have got issues with it, they need to raise it with us. And we reinforce this at the CEO workshop as well. And I think everything's been resolved now anyhow. But if there are issues that you experience, and for example, you don't have equipment to make videos and so forth, then you need to, if you can't get any joy out of discussing it with the grant holder, then talk to Desley, and she'll sort it out for you. Okay, thanks, Ben. We need to be creative and innovative, and I think that's, and working from home, and we get that TikTok or whatever, you can do all of these, and we're seeing a lot of videos and clips and ways to engage. And in some jurisdictions already, we're seeing people even engaging with school kids, even though they're not in the classroom. Personally, they're still able to do it and do exercises remotely. Thanks, Ben. So yeah, be creative. That's the message. And look at those the planning that's needed in all this, and take the opportunity, particularly now, and I'll touch on this a bit later, now to understand the region that you've got to work in, and you can take it now, take the opportunity to now develop a really good strategic approach, so when we can get out, we can go and visit, but get letters off to people, introducing yourselves and going out, and you might know all of this, but I'll bet money that you don't talk to all the organisation in your region. Otherwise, you'd be hero status. Thanks, Ben. and of course there's myself and NBPU that can provide support and guidance if you need it. Next one. Now, why do we look at remoteness as a priority area? I won't go into pregnancy, but in remoteness, and it's just, this is a graph that that's been developed. I think our friend Raglan pulled this together for me, and that is, which is really showing that when we come to the blue line, which is the urban or non-remote, and non-remote is both urban and regional, interregional, we are seeing a drop-off in smoking incidence. But when we get to remote, the green line, you can see that it's pretty much flatlined. So we've got to look at ways in which we can make a difference. And as part of that, a bit later in the year, when opportunity arises, we're going to host, and it may even be next year, host a regional workshop that's just going to focus on how do we intervene and how do we get our impact in remote areas. And so, anybody who's got good ideas or you can demonstrate that things are working, please let us know, let Desley know, and we can make sure we host things like yarning circles and discuss those strategies. But you let us know and we'll make sure you get an invite to the remote workshop so you can brag about how good your services are. Okay, thanks, Ben. The other really important one to think about now is because it's coming up very shortly when tariffs are going to go up again on cigarettes, and we've seen an increase every year of the tariffs, and so that's what the government collects, and so that's had an impact on the price of cigarettes. And the average price, and we're talking urban areas, is around about 94 cents a cigarette, and so it's a pretty big impost on people. And so I give you this just as a resource, a tool that you might use when you're talking to people, because we really look primarily at health impacts, but the economic impacts are so important to think about, because it's they can lead to poverty, and the poorer you are, the less opportunity you have to access good food, education, employment, etc. So it's all a really big revolving area, and I know that you know a lot of this, but that's here. So Ben, next one, please. Just one click. No, not next slide. Go back one. Well, yeah, that was just on that. So that's the health versus wealth. All right. So now the next slide. Sorry. Yeah, and this is another one that's just, again, a resource for yourself. And this is based on $40 a packet. And, we know that $40 is not common from what I smoke, but from what I hear, it's even more than that, a packet. And I know I was talking to one of our very senior elders down in Sydney, and he said between him and his missus, who both smoke, they spend $94 a day on cigarettes, a packet, just on smokes. And so, if you think 94, that's double, triple almost what we got here. But what's important to recognise when you're talking to people, if they think that they're poor and they're feeling stressed and that's why they smoke, well, part of that reason is because of the cost that they're spending on cigarettes. And what we see there is, and I'll put up in the yellow box, what the benefits are that you get at the moment if you're on a pension and with New Start allowance, and it's increased a little bit with Job Seeker, but that's the price. Now, Ben, the next slide. And so what that adds up to is that on Job Start allowance in 2020, a single person gets $14,000 a year in allowances, and a couple will get $26,000. So if you look at 1 year expenditure on one packet of cigarettes, it's exactly the same cost as if for your allowances. So, somebody who's on a pension smokes a packet of cigarettes a day is kissing goodbye all of their Job Start allowance. Really important when you're talking to to smokers, particularly with families and so forth, that you in a respectful way sort of present this type of information to them, because I think it's so impactful, because it's not just health, it's the wealth element, and the wealth, the cost of this, and the impact it has on the whole family situation. It's a precursor, it's a major contributor to the stress that people think that they smoke to relieve. Thanks, Ben. Next one. I've got to press on. The other big one, and for those who've been around for a while, you hear me talk about it all the time, and that is, and this is part of the strategic planning, and this is a list of the ORIC registered Aboriginal and Torres Strait Islander organisations across Australia. This is a Queensland map. So within your region, these are just the ORIC ones. You also have people registered under the state registration or with ASIC. So this is only one part of all the businesses, the Aboriginal organisations there. There is no excuse for why every one of those organisations isn't contacted, isn't offered a service to support them to develop a smoke-free plan for their office if they don't have one, to be able to offer up the strategic support like quit skills, like referral to quit lines, and referral to a doctor. So, if nothing else, this is your major, this should be one of your major target areas to make sure you have impact. And then if you throw on top of this all the schools in your region, and I know through Deadly Choices you do interface a lot with schools, but they're the targets. If we can stop people from smoking, and that's people within organisations, we're hitting a lot of people. If we're targeting schools for not taking it up, we're hitting a lot of people and creating a future. So just keep this in mind, and as we go on, we'll be starting to think about how do you report back on the number of organisations within your region that you actually approaching and developing up plans, because it is across the nation very, very significant. Thanks, Ben. Just a reminder that we have both the NBPU newsletter that goes out, the monthly messaging, and Desley pulls together and her team a whole lot of information. I've been a bit slack in recent times and not contributed, but I try and contribute to that. We also have a monthly TIS communique, which goes out to the service organisations. So, and there's a list of the people we target on there, but that's mainly to go to jurisdictional state and territory bodies to keep them informed about developments, and other major NGOs like the cancer councils and others who receive it, so that we're all kept abreast of what's happening, and how do we leverage off each other, make sure we don't duplicate, we don't compete, because that's in nobody's interest. We want to try and maximise the impact by us all doing, coordinated work. Okay, Ben, another one. And I mentioned earlier the TISRIC website. This is the Health Infonet one. You should know this intimately. This is your go-to place. This is your major resource. Everything that we do gets hosted on there. All the good ideas get hosted on there, and all the reports and so forth. So understand that website and make sure you utilise it. Thanks, Ben. And the other really important part of that are the yarning places, and Desley and the team have really got them, geared up now, and we're really hitting some good topics. And this is just an extract of the launch, how to get onto it. But if you're not already a member of the TIS yarning group, you should be a member. You'll get the alerts about what the topics are. Penny has a big contribution to this as well. But this is where we can share ideas amongst ourselves, and it's only accessible by the TIS workers or by invitation for others like myself to come in. So it's your place to be able to share ideas and to really exemplify best practice so that we can all target this together. And I can't overstress the need for us to be able to continually show advancement so that we can get the ministers on board. And I say ministers because it takes a cabinet decision, and we've got both the Minister for Indigenous Australians, Ken White, and the Minister for Health, in Greg Hunt. All need to be working together on this so that the funding is extended into the future, and that we have some stable policy, which has been absolutely fantastic in the last couple of years, and it'll be for 4 years, the first time in the history of this program that we've had a stable policy approach. So let's hope we can get that extended for the next 4 years plus. Thanks, Ben. And Facebook is the other one. This is Mark, good old Queenslander, real champion. He's put out some great clips about COVID-19. That's just there for your reference. Most would have already seen it, but you can also be putting messages out and doing the same, and looking at ways to engage with organisations, with any of your target group organisations over the internet. And look, I'm dealing with quite a number of people now, who normally would go face to face, but we're all doing it via webinar, and that's big groups like the PHAA, Public Health Authority of Australia, and Public Health Association of Australia, and so forth. So use your Facebook, use your self-created little videos to get your messages out. Now's a great time to become a real, virtual hero. Thanks, Ben. This is just a clip you can have a look at. I found it very interesting, and it's one you can use both at the schools and with other people. It just shows the impact of smoking. It's one of those professionally done, well, yeah, semi-professionally done, but it really demonstrates how much rubbish goes into your system when you smoke. Okay, but you can look at that later. And of course, there's the websites like the health websites and the Commonwealth Health, State Health, all the cancer councils. We've all got elements up there talking about COVID-19 and smoking and the impacts. And, initially when it came out, people were saying, oh, if you're a smoker, you've got better chance of resistance. Well, we know that's not true, because if you've got a compromised lung from smoking, you're going to be more compromised and more susceptible to COVID-19. Although we've managed to dodge a lot of it in Australia, there's no reason for complacency, because every year many Australians die because of the common flu, and that's when they've got compromised systems as well. So, smoking has that impact on too many parts of our body. And another tap then, and again, there's specific advice just on Aboriginal and Torres Strait Islander people. That's just a resource there. There's a whole lot of video clips that have been put up on the Commonwealth Health website for you to have a look at. Okay, another one, Ben. And this is just a clip of what happened in the United Kingdom when COVID-19 came around, and we talked about the susceptibility of lungs, of compromised lungs, and potential for stroke and the vulnerability of people who have low immune systems. We saw over 300,000 smokers quit because of fears of COVID-19. And we don't want to have a big scare campaign, but we want it to be realistic. And so don't think that there's no, opportunity because we've got COVID-19. It's a great opportunity to talk to people about giving up smoking, and particularly referral onto quit lines, and even on quit skills. They have now redeveloped their training program, or they're in the process of doing it. They've got some modules done, so they can deliver quit skills online. And so, they used to have to come and visit. So that's an opportunity now to get across it and either book, but it's part of that referral. Once we get that up and running, no excuse for any of the Aboriginal organisations not to have a health day when they get their staff to sit down and participate in one of these programs. And now's the best time because they can't do normal business, so they're at home. So let's take advantage of that. Thanks, Ben. We've passed World No Smoking and No Tobacco Day, but the message is still there for the whole year, and that is that smoking, be it with tobacco or other nicotine devices, delivery devices like vaping, which is illegal in Australia for nicotine-based vaping, but the impact is the same. It's about how big business, tobacco companies are now moving, how they target kids. They now target the safer alternative, they say, by vaping and so forth. There's a lot of BS and all that, and so don't get hooked on it. The evidence is out there that both vaping and tobacco have detrimental impacts to your health. So help on the website anyhow. That's part of the message to see what's there. Okay, Ben. And again, this is just a reiteration of that earlier slide that I put up and we discussed anyhow, but this is just a reference. Make sure you get across. Use this opportunity when you can't travel to do your planning, to be creative, to be able to interface with our clients. But for me, planning is the most important because you can sit down and do a lot of targeting, particularly of those Aboriginal and Torres Strait Islander organisations that are in your community. And you know what we'll find, and this is something we'll be talking about a lot more during the coming days or the coming months, is because you can't travel, there's going to be savings in your budgets. How do we utilise that in a really effective way that's legitimate? And so there are plenty of opportunities there, but we'll start to explore that a lot more as we get into the financial year. So all the best. I hope you all stayed healthy and you still maintain all of your good activities. And don't forget that both the NBPU and myself are here to support you, and keep up the good work. And Paula, all the best for you guys up in the Torres Straits. Looking forward to coming and visiting. And I must say that I'm a very keen fisherman, so I'll drop that hint for everybody. All right, catch you all and stay safe.
Tom, just move on. You have for a few questions, if there's any from any of the organisations.
Yeah, for sure. I must say, Ben, did you see that? 31 minutes. 1 minute over.
We're going to have to cut you back that 1 minute next time. Anyone want to ask Professor Tom anything before we move on to the next session?
I'm here for all the time anyhow. But, the key thing that we say, and particularly if you're new, there's no such thing as a day. If you got a question, you can bet your money that somebody else in the room's got a similar question. So, yeah, we got one. Did I see a hand go up there? Gary, did you have a question, or were you just shooing off a fly? No, nothing.
No question.
Thank you.
I might just ask if you can all check the chat.